All right, so today we're going to be needling a rotator cuff. This patient has been dealing with a little bit of posterior rotator cuff pain after doing some gardening over Memorial Day weekend. So we are going to locate teres minor and the infraspinatus tendon that come along here, and then one comes up underneath. We've already marked out our locations for where we're going to needle, and we're going to do a little bit of stim with these muscles as well. So we kind of do a nice, easy poke. It shouldn't feel too painful. Okay, so now we're going to turn the patient up on a little stim. We're going to try to activate those muscles a little bit. So we're going to do the teres minor and infraspinatus first on the outside of the shoulder. You should start to see a little twitch. There it goes. So we're just going to kind of let it twitch a little bit and work itself out. We usually do this for somewhere around a minute or so, and then we'll do the infraspinatus afterwards.